All right, today we're going to master a skill that is so fundamental to medicine, but you'd be surprised how often it's done incorrectly. We're talking about measuring blood pressure, and we're going to do it by the book, using one of the most respected texts out there, Harrison's Principles of Internal Medicine, as our guide.
So let me just start by asking you this. Have you ever wondered if that number you got at the doctor's office was, truly accurate? Because the stakes here are incredibly high. A reading that's off can lead to a misdiagnosis or even unnecessary treatment. It's a big deal.
And this is exactly why it matters so much. As Harrison's puts it, accuracy isn't just some small detail. It is the entire foundation. Getting this right is literally the first, most critical step in managing one of the most common health conditions on the planet.
So, in our quest for that perfect reading, we're going to break it down into 4 clear stages. We'll start with creating the perfect setup. Then we'll get the cuff size and placement just right. After that, we'll walk through executing the measurement itself, and finally, we'll cover how to make sure the results you get are actually accurate.
First up, the perfect setup. Now, you might think the measurement starts when the cuff starts to inflate, but honestly, the most common errors happen before that cuff even touches your arm. So let's look at what the ideal conditions are.
First, the body has to be in a true state of rest. And that means at least 5 minutes of just sitting quietly. No running from the parking lot and jumping straight into the chair. And you've got to avoid things like caffeine or smoking for at least half an hour beforehand, because they can temporarily spike your blood pressure and give you a totally false reading.
Okay, now let's talk posture. This might seem really basic, but every single detail here matters. The person has to be seated, with their back supported and their feet flat on the floor. And why on crossed legs? Well, because crossing them can actually bump up your systolic pressure. And, of course, the measurement has to be on a bare arm, never ever over clothing, which can mess with the reading.
And here it is. This is one of the most common and most critical errors. The arm has to be supported right at the level of the heart. If the arm is hanging down too low, the reading's going to be artificially high. If it's held up too high, the reading will be artificially low. Getting this right is absolutely non-negotiable for an accurate result.
All right, once the patient is perfectly positioned, our attention turns to the cuff itself. This is our single most critical tool for the job, and getting the size and placement right is everything.
So, how do you pick the right one? Well, here's rule number 1. The inflatable part of the cuff, they call it the bladder. It has to have a width that's at least 40% of the circumference of the upper arm. And right on the heels of that is rule number 2. That same bladder has to be long enough to wrap around at least 80% of the arm. If you use a cuff that's too small, you're going to get a falsely high reading. If it's too big, you'll get a falsely low one. Seriously, when it comes to cuffs, size is everything. Once you've got the right size, it's all about placement. You want to wrap it snugly. Not too tight, not too loose. About an inch or 2 to 3 centimeters just above the crook of the elbow. That spot has a medical name, the antecubital fossa. And that's exactly where we're going to be listening in just a minute.
Okay, the stage is set. The patient is ready, the cuff is on. Now for the main event, executing the measurement. This is where we stop preparing and we start listening for those vital clues about your health.
So here's how it goes down. First, you feel for the pulse of the brachial artery right in the crook of the elbow. Then, you place your stethoscope right over that spot. You pump up the cuff until you can't feel the pulse anymore, and then you keep going for about another 20 to 30 points. And this last step, this is where so many people rush it. But it's crucial. You have to deflate that cuff slowly. We're talking 2 to 3 millimeters of mercury per second. Any faster than that, and the whole measurement is basically worthless.
So, what are we actually listening for? They're called Korotkoff sounds. That's the official name for those little tapping sounds that show up and then disappear as you release the pressure from the cuff. And these sounds, they're the key to everything.
These sounds are like the secret code to your blood pressure. The very first clear tap you hear, that corresponds to the systolic pressure. That's your top number. Then you just keep listening, and the exact moment those sounds vanish completely, that gives you the diastolic pressure, the bottom number. It's really that simple. First sound, last sound.
But hold on, we're not done just yet. Getting one number isn't good enough. Our final section is all about making sure the results are reliable and not just some one-off fluke. This is how we verify that final number.
To really be sure, you should always take at least 2 readings, wait a minute or 2 in between, and then average them. And for a first-time assessment, it's so important to measure the pressure in both arms. A big difference between the arms can actually point to an underlying problem. And what if the readings do differ? You always take the higher one as the official measurement. And this little detail just shows you the level of precision that's required. Blood pressure should always be recorded to the nearest 2 millimeters of mercury. This isn't about rounding up or down to the nearest 5 or 10. It's about being as precise as the equipment lets you be.
And that really brings us to the core message of this whole thing. It's not about some secret, fancy technique. It's all about standardization. When every single step, from prepping the patient to recording the final number, is done the exact same way every single time, that's when you get results you can actually trust.
And that's the real takeaway here. You're now empowered with the knowledge of what the gold standard actually is. So the next time you have your blood pressure taken, or maybe you see it being done, what are you going to look for? Will you notice if the arm is supported at heart level, or if the legs are uncrossed? Now you know exactly what to look for, and more importantly, why it all matters so much.